So it's simply just like that, if you have something that's bothering you, bothering your peace, why not we take steps in trying to seek help and support and find ways to overcome it. And I saw this poster that says, mental health is a right. But I would always say mental health is a choice. It's not a right. It's something that you need to know that you have to prioritize. Saying thank you to your heart also for it to be beating. I think these little practices can make such a massive change in your life. So ask those 3 questions. Am I looking after my body? Am I looking after my mind? Am I looking after my relationships? Don't try to be superheroes in front of your children. I think life is all about ups and downs. You might have been through terrible, horrible, miserable moments in your life. You might have gone through failures in your life. You might have had heartbreaks in your life. Be very emotionally genuine to your children. And then you can see how their personalities build up as well. I would say self-acceptance is highly essential, and validation to your emotions is highly essential also.
The Project Mind You 2.0, an initiative of the Healthcare Avenue of the Leo Club of University of Kelaniya, aimed at uplifting the mental well-being of our dearest undergraduates. We warmly welcome you all to our discussion, which we hope will get in some insights about your mental well-being.
Health is not only about the body, but it's a combination of the harmony of mind, body, and spirit. Today, we will be focusing on the most neglected symphony, mental health. Joining us today is a special guest who is profound as a personality development coach, a public speaker, a psychologist, and a psychological counselor. We warmly welcome you, Ms. Rasini Bandara, who will be sharing her insights with us in order to help us to understand the importance of mental well-being. Moving forward, ma'am, in common parlance, people tend to care more about their physical health than their mental health. So I think it is important to care about mental health as well. So according to you, ma'am, what is mental health and why should we be aware of it?
Well, thank you so much, Pabsara, for having me here, and also to all the Leos of University of Kelaniya for putting this together to bring in awareness. So, well, what is mental health? Well, mental health is something that is absolutely normal. There's nothing abnormal about it. Mental health means when an individual is able to very productively give back to the society, at the same time be productive to oneself also. And at the same time dealing with daily hassles and daily stresses, manage it appropriately, and have a very balanced and a very healthy life. That's what mental health is. I'm sure that there is a much more bookish definition, but however, to be a productive individual, that's mental health. However, like you said, it's something that's very much neglected also.
So ma'am, why should we be aware of mental health?
Well, let me tell you, so when we talk about the whole definition of health according to WHO says that it's your physical well-being, it's your mental well-being, and then it's your social well-being. We can add the spiritual well-being also, but then we have people who have different faiths, so exactly you can't put a definition to that. But however, it's a beautiful symphony and a beautiful harmony of all these 3 elements. So being healthy is not merely an absence of an illness. So not having an illness at the moment doesn't make you a healthy person. So all these 3 elements, I mean, it's not that, because usually, like you said, that we give a lot of importance to physical well-being and we always talk about it. But then, just like you give importance to physical well-being, you have to give that same, or I think much more importance to the other 2 elements as well. So it's a combination of all these 3. So you can't neglect one aspect of it.
That's right. So are there any common mental health issues that you have seen among undergraduates?
Well, I think stress is one factor that all of us go through. So I'm sure that, when you're an undergraduate, you have your assignment stresses, you have your examination stresses. On top of that, you have relationship problems. And then, the things that, even relationships are not just the intimate ones. I mean, your relationship with your lecturers and your family. And some of you might be coming from long distances and settle down here and studying quite far away from your hometown. So all these factors, of course, work towards stress. And at the same time, I think stress, we will not call it a mental illness or a big problem, but it's something that is absolutely normal. However, stress being in your system for a long time can direct you to conditions like depression, anxiety, and at the same time, certain people might suffer from other small, variations and conditions also. But I would say depression, anxiety are the two most that can be seen among undergraduates.
My next question to you, can be a common question that people are afraid to raise.
Okay.
My question is, should we be ashamed of finding solution for mental issues? And what's your advice about this, ma'am?
Okay, so if I ask you this question now or there, right? Okay, so let's say now there you have fever today. You have high fever. And okay, so you take 2 Panadols, let's say, or apply some balm or something to feel better. Tomorrow also you're having fever. So now it's a problem. Am I right? Especially nowadays, you don't know what this fever is for. So then it's a problem, and then are you afraid to seek solution for that problem? So are you afraid to go to a doctor to see what's wrong with you? You're not afraid. So it's something as simple as that where, if you're not afraid to seek solutions for other physical problems. Let's say, for example, if you don't have food, you solve that problem by trying to seek food. If you don't have safety, we try to find solutions to find safety. If we don't have love, we of course exercise towards finding a partner or somebody to, have a relationship. So it's simply just like that. If you have something that's bothering you, bothering your peace, why not we take steps in trying to seek help and support and find ways to overcome it? So I think because, honestly, like especially, in this region, South Asia, and at the same time, I won't just say South Asia, because I have traveled quite a bit to the Western world and in the Arab world, and likewise. And then to see that mental health anyway is a taboo. People don't like to talk about it, because when we say, at least let's say psychology or mental health, we completely connect it to a mental asylum. Because, people think that you're insane and this is where you're going to. So there's so much of stigma around it. And people think that, if you really open up and wanting help, that shows that you have no character, you have no personality, you have no backbone, you are not someone who's competent enough. So all these things are still there. So I would say that thanks to this younger generation like y'all, I think people are getting a lot of awareness about it, because the more you talk about it, the more that stigma will go away. The same thing happened when with HIV. People were scared, even to stay close to someone, sit next to someone. But then when people got, awareness about it, and then everything changed. Just like COVID also. We had so much of, stigma with regard to COVID. But then now, of course, I think even now COVID exists, but still we are living. So therefore, we don't have that sort of fear. So mental health is also something like that. And people should consider that it's also health. And at the same time, choosing your mentality, prioritizing your mentality is actually a choice. Very recently, I was at a university, private university, where they celebrated World Mental Health Day. And I saw this poster that says, mental health is a right. But I would always say mental health is a choice. It's not a right. It's something that you need to know that you have to prioritize. So I think one shouldn't be afraid and one shouldn't be ashamed of prioritizing, your mindset. So it's something like that.
Yeah, I agree, ma'am. Moving on to some common mental issues, anxiety is considered as a normal and common health aspect. So, how do you define anxiety? And anxiety lead to depression?
Well, actually, anxiety, like you said, it's very common. It's a fear. Now, when your exams are near and you have anxiety, your anxiety is because you'll never know what the result would be, or it could be the fact that you are anxious because you don't know whether you'll be able to finish it off by time. So all these factors. So the thing is, what happens earlier, you'll start getting anxious for things that's let's say it's reasonable to get anxiety, like expecting when you anticipate results, then yes, of course we get anxiety. I think living in Sri Lanka, we are anxious every day because we are thinking we don't know what's going to happen, so we have absolutely no clue about what's going to happen. So that's where anxiety starts building up. We build a lot of anxiety, especially with regard to future, what's going to happen. But the thing is, the longer that it stays in your system, your body starts liking it. So then what happens is, the problem is where you start getting anxious for everything. And sometimes you might start getting anxious for things that you shouldn't be getting anxious. So because it's more like you have built a house now, inside your mind for anxiety to stay. So even I think every condition is like that. The more it stays in your system, the more it gets adjusted and adopted. And yes, anxiety has a possibility of going into depression also. But it's not a fact that anxiety will definitely lead to depression. Even stress factor, we always say that stress has a major possibility of developing into depression, but it's not that it's a must, and it's definitely going to happen. And of course, anxiety is treatable, and sometimes certain people with medication, but some, of course, with therapy itself. It's about replacing your anxiety-provoking thoughts with the right kind of thoughts. So I think even, for example, let's say, even though we speak about it, we mental health care professionals also, we go through anxiety. We have. I mean, it's like you said, it's a very normal thing. But then anxiety becomes a problem when it starts staying in your system for a long time, that it refuses to go away, and that it starts affecting your daily activity. And when you get into a phase where like you experience panic attacks, so then you are withdrawing from certain situations, like for example, let's say social gatherings, and like when you have to perform as an individual, when you start neglecting those things, then of course, yeah, it becomes a problem.
So diving into this discussion further, ma'am, can you give us a definition about depression and what causes depression?
Okay, so it's going to be quite a heavy one. Now, depression is very different to that of stress. So when we speak about the symptoms of stress, physical, psychological, and then behavioral, we have a lot of similarities to depression. But however, there are few very significant symptoms that draws that line between stress and depression. But however, I think depression is also one of the most misunderstood words as well. Now, especially the younger generation, when you ask them, how's life, something they would say, it's so depressing. is a terminology now very commonly used. But depression, of course, when you say depressed, it means feeling low. But at the same time, in order for someone to be clinically diagnosed as having depression, you need to have a very significant change of behavior. Like, let's say, a drastic change. It's not just a change, a drastic change, and then certain symptoms lasting for more than 2 weeks, consistently in someone. And that is only when someone can be called as depression. So, for example, let's say loss of interest in daily activities. At the same time, loss of, interest in some terms of your sexual activities. And then, feeling very low, and, all these factors, there are so many symptoms that tells the fact, at the same time, feeling very much of lack of self-worth, at the same time, suicidal ideations and things like that also. Extreme weight gain, it could be extreme weight loss also. So such things. And then certain symptoms like that lasting for more than 2 weeks can be diagnosed as someone having depression. Again, a lot of people live with depression. The causes for depression, of course, I think there's so many. I would say childhood trauma, experience certain things that you have been through in your childhood. It could also be abuse and all these factors. At the same time, neglect also. If you've been neglected as a child, that can be quite traumatic also. And then at the same time, major change in life, major life events. It could be losing a loved one, someone who's very near and dear to your heart. It could be at the same time change of environment also, a drastic change of environment. Sometimes you could be going from one school to another, and going from school to university, and at the same time maybe changing your branch from one city to another. Such things, and even I would say even marriage, because people might not think about it, but then you are used to a particular way of living. Sometimes it's our bathroom habits, it's our bedroom habits, all these factors, sudden change in life. And even sometimes, going from one country to another. People think that it's hell here, you're going to find paradise there. But then I have a lot of clients who reach out to me from abroad because of that the change of life, that they are experiencing symptoms of depression. And so such things, and at the same time, it could also be biochemical reasons. It could be certain medication that you're taking for a certain illness, and such changes can happen in your body also. It could be because of alcohol, drug abuse, and all those things as well. So there are so many reasons for someone to go under depression. And at the same time, let's say, for example, if someone, especially, when it comes to relationships also, such things can put someone in a very, very low mood. And that low mood being there for a long time, not seeking right help and support, can actually take you there.
Yes, ma'am. So it's like we cannot give a exact definition about depression, as it varies from each person.
I won't say it's actually there's a fixed definition. Let's say that, like somebody experiencing a drastic change in their life, and at the same time that's towards the negative side of it, and that's where you can say that it's depression. But then the reason for someone having depression always changes, and at the same time how they manage it, and at the same time it always depends on the severity of it, based on how you seek help and support. So depending on the support system you get, sometimes you have a way of recovering from it easy or managing it easy, but sometimes there are ways that people can be highly depressed but then not seeking help. That can actually lead to self-harm and then even suicide also.
So, ma'am, are there any specific levels of depression in order to seek medical assistance?
Well, we have onset, like for example, depression has just set in, and then you have mild to moderate depression. Likewise, we have. But, when it comes to sometimes mild to moderate depression, sometimes exercises, things like that also works as, I would say it's, as a treatment. But the thing is, sometimes even at onset, certain people need to go under medication because it again depends from body to body, person to person. and also how you look at it. It depends on what your support system is. You see, we always say that we are in the same boat, but we are not in the same boat. We are in the same sea, but we are in different boats. So your boat is your support system. So it always changes. Someone might be able to recover very quickly from depression, come out of it very quickly. At the same time, someone might stay in it for a very, very long time.
Then, what are the other mental issues that we should be mindful of in order to lead a healthy lifestyle?
Okay, so other than like I said, depression and anxiety. So stress, like I said, it's a normal thing, but too much of it being in your system can cause issues. So depression is actually an illness. It's considered as a mental illness someone goes through. So then, yes, you need proper treatment. Even in some cases, medication also. Anxiety, again, normal, but then when it goes to anxiety disorders, it's a problem. So other than these things, I would say specific phobias. Sometimes, maybe you might experience it among, your friends also. A lot of people suffer from things like, let's say, glossophobia. That's a fear of public speaking, fear of tongue. Social anxiety, social phobia. So such simple, I would say, simple phobias would be there, and which actually very much affects someone's social life also. And other than that, there's also, I would say, eating disorders, especially because of the fact that people exercise a lot of importance into the body types and all these things as well. People want to be, like thin and slim, and have a certain body type. So because of such things, anorexia nervosa, bulimia nervosa, this is also quite common among teenagers and even undergraduates. Other than that, I would say generally, I think one or two people among your friend group might actually go through conditions like, let's say, bipolar disorder, whereas you experience a massive fluctuation of going into a manic phase and then a depressive phase. But that again has many other reasons of why you could get bipolar, and also sometimes OCD. But I would also like to share this thing, because nowadays we have our world, the world on our fingertips. I have met so many young individuals who self-diagnose that they have this condition. They self-diagnose saying, I have ADHD, attention deficit hyperactive disorder. They diagnose themselves as, I might be having OCD, obsessive compulsive disorder. Sometimes they self-diagnosed saying that I have a depression. But then when I asked, okay, so who's the doctor who diagnosed this, or who's the clinical psychologist, and they would always say, it's Google said it. So like I said, awareness is there, but do we have the right kind of awareness is always a problem. So it's always very healthy for you to walk into, go and see a clinical psychologist or a psychiatrist, and to see whether am I actually having these conditions, or does it say this? Because sometimes, sadness is something we all go through. We all experience it, and sometimes we might feel sad for a couple of days also, but that doesn't say that you are going through depression. So you have to be very careful with such terminologies also. And the things that I mentioned are actually some of the most common things: phobias, then types of anxiety disorders, then sometimes even PTSD, post-traumatic stress disorder also. It could be trauma with related to childhood. It could be a trauma with related to any incidents that has happened in your life. It could be trauma with related to an accident also, road accident as well. And sometimes if you are someone who witnessed a particular crime or some sort of a very shocking incident, that can also give you PTSD.
Yeah, I think it's great explanation for our audience. And next, embracing mindfulness can bring positive changes into our lives. So, what are your thoughts about this, and how do we practice mindfulness now?
Mindfulness is very easy. You see, like now, for example, let's say nowadays, just take a moment of someone ironing their clothes. And when you're ironing your clothes, you have your phone, mobile phone, like that, and then you're doing it. It's very good that we are able to multitask a lot of things, but the thing is, in this process of multitasking, we actually forget to pay attention to one thing. Give that undivided attention to one thing, selective attention to one thing. And this is the reason why we are very forgetful also. So we are not actually living in that moment. When we are eating, we are not mindful that we are eating. We are watching something and we don't know what we are putting in our mouth. When we are doing a certain activity that needs our attention, then we have so many other things that's going on around us. So sometimes, see, even if you're seated down, you're having a cup of tea. When you're eating, let's say when you're doing some sort of a painting or something like that, anything that you're doing, you have the ability to practice mindfulness. I mean, when I go and do corporate workshops and things like that, we sometimes do like mindfulness eating activities, these things. And then they find, it's about just focusing and concentrating on one thing for some time. It's very easy. And at the same time, very, very basic practices. Like, for example, let's say sometimes writing down your moods, I think it can be highly cathartic when you write down your thoughts, how you feel, whether it's a good mood, bad mood, things like that. At the same time, certain things that you're actually grateful in life also. I have this practice which I do with my kids. At the same time, when I go to schools, I usually empower this activity. I say that, make a happiness jar. So every night before you go to bed, write one thing that brought a smile to your face. I think if you look at 24 hours, you are able to find at least one moment that put a smile to your face, And when you do such things like that, when you go to bed with such thoughts, I think it's very healthy. Because again, like I would like to say this, love, that, we get a lot of, like, I think we worry so much in life, thinking about the things that we did. So we exercise a lot of worrying into it, but then we have absolutely no control to change it. At the same time, we build a lot of anxiety thinking about the future, which again, we do not know what's going to happen. And in this process of worrying about your past and being anxious about your future, we forget to live in the moment. So this is where, like, even in Kung Fu Panda Master Uguay says, yesterday is history, tomorrow is a mystery, today is a gift. That's why it's called present. And we forget it. So once this moment is gone, then it's not a moment that you can bring back. So I think that whole attitude of living in the moment, embracing the moment, appreciating things in the moment, because you'll never know whether once this moment is past, it's going to the past, and you have no control. And then we are not having any assurance of the future or even the next moment, right? So I think again, a way of living like that. I'm not telling you all to not to have dreams. Of course, you have to have dreams and goals and all those things. Yes, but still, I think embracing every moment, celebrating yourself every day, appreciating yourself every day. I would say even sometimes saying thank you to your heart also for it to be beating. I think these little practices can make such a massive change in your life.
So, as previously mentioned, ma'am said mental health is not a right, it's a choice.
Yes.
But sometimes people are ashamed to talk about their mental issues. And especially in Sri Lanka, it's a topic of social taboo. So, is there any message to the audience in order to convey a message like, is there any specific thing that you would like to give to the people?
Right. So I think from smaller days, we are brought up in a way that we are very passive communicators. We are very passive listeners and we are very passive learners. We always do what we are told to do. We never raise questions. And at the same time, then, as you grow up, we always have the passing the ball attitude. So I think looking after your mental well-being, focusing on your well-being, let's say, like I said, when you say well-being, it's about your physical well-being, it's about your mental well-being, it's about your social well-being. I think that should be considered as a responsibility. It's a responsibility to yourself, so you need to be very accountable for yourself, and at the same time you have to be consider that as a social responsibility also. So when you change your mindset, when you change your attitude, that you consider that as something that's very healthy for you, that it should be a very active choice, I think you change that attitude of a lot of other people also around you, because it goes as a chain reaction. And it's about, I always say this, it's about asking these three questions from yourself. Am I looking after my body? Am I treating it well? Am I exercising well? Am I exercising not to have flaunting abs or getting a six-pack, but am I exercising because it brings fitness to me? Am I eating right? Am I putting good things into my body? Am I grooming myself very well? Do I have self-acceptance as an individual? And at the same time, I would say the next question, do I look after my mind? Am I doing things that puts a smile to my face? Am I studying something that I'm passionate about? Do I have a purpose in life? I think these are very simple questions. And at the same time, I would also like to say that even being a mental health care professional, and I would say I kind of maybe throw my wisdom at people also, but at the same time, when I'm going through a problem, I lose that clarity that I have. So even it says the fact that even healers need healing. People who take care of others need to be taken care at some point in life as well. People who surprise others need to be surprised on and off as well. So I think there's no shame. People shouldn't have shame about this. At the same time, I always tell parents. I mean, even yesterday at a talk, I told parents, especially, that don't try to be superheroes in front of your children. I think life is all about ups and downs. You might have been through terrible, horrible, miserable moments in your life. You might have gone through failures in your life. You might have had heartbreaks in your life. Be very emotionally genuine to your children, and then you can see how their personalities build up as well. Because I would say self-acceptance is highly essential, and validation to your emotions is highly essential also. So I think this should start from smaller days. So never be ashamed to even cry in front of your children, because your children also need to know sometimes our parents cannot, be handling everything also. They also fall apart, and it's a part of being a human being. And also, resilience starts building up the moment you embrace your vulnerabilities. You need to have acceptance that, this is a terrible situation. If you're in denial, there's no way that you will have a mindset to seek help and support. And I think seeking help and support does never establish the fact that, you're a weak person. It shows a lot of courage, because in a world where we think that opening up is so bad, but it's actually when you open up that also open the space for a lot of other people to open up as well. I think you yourself can be one of those individuals who break that stigma. So I think, like I said earlier, mental health is a choice. So ask those three questions. Am I looking after my body? Am I looking after my mind? Am I looking after my relationships? I mean, I always tell people, if you wake up one day, now especially for you youngsters, if you wake up one day and your relationship, you feel like you have to write a big assignment or a project, run the opposite direction. Never stay in it. Don't stay in a place where it's draining you. Every day you feel like, oh my God, I have to do this. Get away from it. And don't stay in a place where respect is not given to you. You be in a place where you are given value, and you are able to give value as well, where you are respected as an individual, a place where people are not trying to change you according to how they want you. No, it shouldn't be that way. And I think that shows a lot of self-respect as an individual also. So have that accountability is something that I want to share.
Thank you, ma'am. It is indeed a very valuable lesson to us undergraduates.
Thank you so much.
Moving towards the end of our insightful conversation on mental health, it's evident that taking care of ourselves involves finding a balanced connection between our mind, body, and spirit. So, we want to express our sincere gratitude to Ms. Rasini Bandara for sharing her insightful thoughts and experiences with us on the importance of the mental well-being. So, thank you for the invaluable guidance, ma'am.
Thank you so much, honey. Thank you so much.
In face of challenges, let's work actively on supporting and understanding our mental well-being and making our well-being a priority. Thank you for being a part of this discussion.